Hi everyone, thank you for joining today's webinar on electronic prescribing in your practice. This webinar will cover all the content that we have previously done in our NZePS webinar, as well as the enhancements that have just been made available. We can appreciate how busy everyone is at the moment, so thank you for joining. If for some reason you can't attend the entire session, a recording of today's webinar will be made available to you by the middle of next week probably. Okay, so this is our agenda for today. We'll start with a few pointers on how to use GoToWebinar, and then I'll begin the presentation. We'll have time for questions at the end of the presentation. If you've got any questions about the audio or visual connection with GoToWebinar, we'll try to answer those immediately. You should be able to see the control panel on the right-hand side of your screen. If you click the orange arrow, that will collapse the control panel. The orange microphone there tells you that you're muted. All audience members will be muted for the session. The next icon will either maximize or minimize the screen that you're viewing the webinar in. We recommend that you keep it maximized. If you have a question, please type it in the box where it says enter a question for staff, and we'll try and answer it at the end of the session. If your question isn't answered directly, then someone will be in touch in the next 1 to 2 days to assist. Sorry about the background noise. So we'll start things off now. My name's Holly. I'm the Clinical Product Specialist here at Medtech, and I'll lead the presentation today. At the end of the presentation, Romit Walters, our Product Specialist, and Chrissy Patterson, our Product Manager, will commence the Q&A session. Before I start the demo, I just want to point out that the webinar today is designed to show you the workflow of NZePS in your PMS. I won't demonstrate every single message and status of the prescriptions and other functionality. That's all clearly explained with screenshots and instructions in our Insight Customer Portal user guides and webinars there. I'll list the resources at the end of the presentation of where you can access that information. And just to reiterate, I'm repeating the content that was demonstrated at the last webinar, as well as the new enhancements that are included in the version 22.20 build 6477 release. Okay, over to Medtech. So the overarching structure of NZePS is that when you prescribe a medication, an electronic copy of that prescription is uploaded to what we call the broker. The pharmacist receives that physical prescription and matches it by the barcode to the script that's in the broker. I'll explain signature exempt prescribing in this presentation today as well. So previously we've communicated that prior to activating NZePS in Medtech32, you need to contact the Ministry of Health to get your credentials. However, in response to the COVID-19 pandemic, and in order to encourage practices to utilise the NZePS functionality, all practices have had their credentials generated by the Ministry of Health already, so you can bypass that step. In order to use NZePS in Medtech32, you need to be on a minimum version of 22.15, but to get the full functionality, including the enhancements, you need to be on the latest release. If you have any errors when you're trying to activate NZePS, then you need to first contact the Ministry of Health just to check that your credentials have been loaded by them correctly. So the first step is to check the HPI facility number in your location settings. So if you find your location, and under the Codes and Defaults tab, you need to make sure that you have an HPI facility number in there. All practices should have that. Next, you need to identify all the green scripts. So these are drugs that aren't dispensed by a pharmacist. The reason you need to do this is to make them identifiable in the PMS, so they're not included in the electronic prescription messages. If your practice doesn't use green prescriptions, then you don't need to do this. But if you do, then you need to run that by going to Utilities, Prescribing Tools, and Green Script Update. Finally, you need to activate ePrescribing. So to do that, we'll go to the Setup menu, Connected Health Information, ePrescribing. You need to make sure that the 2 tick boxes are ticked at the bottom of the screen in order to activate, and this button will say Activate, where mine says Deactivate, because that's already been done. For more information on the disclaimers or any other information in the links here, please read the full release notes, which are on Insight. Once you've completed those steps, then you need to choose which staff members you're activating to use NZePS. So you'll see the Activate Staff tab here. Individual prescribers can choose whether or not they want to use NZePS. So to reiterate, it's not an all or nothing process for your practice. If some prescribers want to use it and some don't, that's absolutely fine. To be activated, the staff member needs to be set up as a provider and a service provider and must have an HBI CPN number and relevant registration number in the provider tab of their staff setup. Once you've ticked who you're activating, then you can exit out of that screen. So we'll start with general prescribing. So once activated, you'll prescribe medications the exact same way that you do now. There are a few additional details for you to note, but the general workflow of a prescription is exactly the same. So if we go into a patient, I'll just select a different patient. So for this patient here, if I'm going to repeat the Augmentin amoxicillin prescription for them, I can repeat that. If I go into this medication here, firstly, you can see that there's a dispensing tab, this one here. So that's how we know that we're activated. This tab here has additional information of what you can communicate to the pharmacy. So you can show the pharmacist that this is an unusual dose, or that you've changed their long-term medication dose, or that you'd like them to complete an assessment for the patient. You can set a reminder if the patient hasn't picked up the medication hasn't been dispensed, it can be changed. This number here will pull from your setup, but you can change it manually for each prescription if you want to. If you want more information about what's in this screen, you can just click on this little blue help icon there and it tells you all the details in there. Okay, so you've prescribed that medication there. So when you're in this window here, if you click on the green print button, this will print the prescription. So if your print settings are set to a physical printer, then that will happen. Mine is not set to a physical printer, so I'll come up with a PDF message there. So I'll just cancel out of that. And you can see that the ePrescription has been generated at the bottom. So this is how you know that an ePrescription has now been sent to the broker. This also means that the prescription has been generated with a barcode. So this prescription here is the ePrescription that will have the barcode on it as well. If you've printed that prescription out, then you'd sign it and give it to the patient to take to the pharmacy. And if the patient has done a request for a prescription, you'd send that to the pharmacy, however your normal workflow is, whether that's posted or faxed or whatever you're doing. I'll talk about signature exempt prescribing a little bit later. So now we'll cover what you need to do if you need to amend a prescription. So let's just say I've generated this prescription, but I now want to change the dose. What you need to do is select the ePrescription, so not the top one, but the actual ePrescription itself, and click this amend icon here. So it's going to come up here with a warning message, which is telling you you're trying to amend a prescription, so I can click yes. So it's important if you're going to amend a prescription that you need to destroy any hard copies of that previous one that we've just printed, and that's just to mitigate any clinical risk to the patient by picking up an incorrect prescription. So that's cancelled that off the screen. You can open this prescription itself and change whatever you need to change, and then click that print button again to generate the new ePrescription. In the previous webinar, we had a lot of questions about the amend functionality, specific to how often can you amend a prescription, what happens to the barcode if you amend a prescription. And essentially, when you click that amend icon, it's cancelling that ePrescription. So when you reprint that prescription for that medication, it's generating a whole new barcode. So that pharmacist will be matching the physical prescription that they receive from the patient or the practice to the barcoded prescription in the broker. So while we call it an amend functionality, it is cancelling that ePrescription from the back end. There isn't any limit to how often you can do that, but hopefully it doesn't take more than 2 attempts to do that prescription. So now we'll cover the workflow of someone else generating a prescription on behalf of a prescriber. So a common scenario for this is if I'm a nurse generating a repeat prescription for the doctor to verify and sign themselves. So we'll just change patients here. So for this patient here, I'm going to just prescribe some Panadol. And fill out however you normally do. So whatever your process is, this is obviously likely to be a repeat prescription than a new generation. So once I'm in this screen here, you'll see there's an orange print and pack icon. So what this does, if I print it, you'll see, and again, I'll cancel off the PDF, it says packed e-prescription at the bottom here. So this prints a draft of the prescription, which then needs to be reviewed by the doctor. So when you click that print and pack button, a task is generated for the person that generated the prescription, so the nurse, to say that the prescription is waiting to be finalised. So workflow-wise, I've print and packed the prescription. Whether I've actually printed that physical prescription or not is up to you and your workflow. And the next step of notifying the doctor that this prescription has been generated also comes down to your workflow. So we do also get a lot of questions about this as well. If you think of it, how do you normally notify your doctors of a repeat prescription request? You can do it on appointment books, you can send staff tasks, you can print it and slip it under their door, or print it and put it in their filing cabinet. Whatever you usually do in your practice, what this print and pack button is doing is just printing a draft of that prescription without a barcode. So for the doctor, once you've notified them, however you're doing that, they need to click if they're happy with that and select the normal print icon there, and that will then print and send that prescription to the broker as an e-prescription with a barcode on it. Okay, so just to reiterate, how you notify the prescriber that they need to verify and create that prescription is up to you. We're happy to answer questions about that at the end of the session if there are any. So now I'll talk a little bit about paperless prescribing. So this is the process of emailing or e-faxing a PDF copy of that prescription to the patient or the pharmacy to then be matched to the electronic prescription in the broker. So this is also called signature exempt prescribing. E-faxing is one of the enhancements from the latest release in NZePS. So there's a current Director General of Health waiver that permits signature exempt prescribing during the COVID-19 lockdown period. So the Ministry of Health have indicated that this is in force right now, and there's been no notification that it's expired or being revoked as yet. And we are led by the Ministry of Health on that. Signature exempt prescribing is not authorised for controlled drugs, and I'll talk specifically about controlled drugs in a little bit. So before I go through the workflow, I'll just quickly go over the setup required for either e-faxing or emailing prescriptions. So e-faxing doesn't require a physical fax machine or a hardwired phone line because the fax is sent out over the internet. If you're wanting to use the e-fax functionality, you first need to sign up by contacting your account manager or emailing sales@medtech32.com. Once you've completed that sign up, then you need to enter your credentials that we provide you in the location settings, and I'll show you where that's found. So if you open your location and go into the Web Forms tab, the electronic fax details you'll see at the bottom right hand side there. Once you've entered that information, you need to log out and back in again, and you need to make sure that you restart your Medtech services on the practice server as well. With regards to the email functionality, depending on how your email is configured in your environment, you may or may not see that email being sent. But in order to be able to do signature exempt prescribing, you need to set up, make sure that you've got the Medtech printer set up installed on each workstation. So each desktop that you're using needs to have the Medtech printer installed, and that's through your utilities menu, Medtech printer, and follow the prompts to install that. This just enables you to print the prescriptions to a PDF on that machine. Next, you need to change the print settings to default the prescription to print to PDF. So to do that, we go into our print setup menu, and you can see here mine's defaulted to a PDF printer, and that's why before when I clicked the print icon, it was showing me asking me how I wanted to save the PDF. So that's what you want to do for paperless prescribing. This needs to be done for every person that's going to be doing NZePS paperless prescribing. Also in that print setup menu, just a point, is the pharmacy section at the bottom here. Leave this blank unless you've got a pharmacy on site that you print directly to. That's likely going to be blank for your clinic. In order to be able to email prescriptions to a pharmacy, an email client such as Outlook or Thunderbird should be installed on each workstation. If you're working from home and remoting into a server, then you need to make sure that there's an email client installed on that server. And we also recommend that you use a generic email account on that machine so that the same account can be used by all providers that are trying to connect and doesn't need to be reconfigured at all. So the way we email to a pharmacy is through your address book. So you just need to make sure with your pharmacy, my pharmacy is called Happy Pharmacy. Here, you need to make sure that you put the email details in for your pharmacy. We've got a utility available on our website, on Insight, where you can download pharmacy details that are specific to your area as well. And I'll show you where that is later on. So to begin this, we will prescribe a medication just like we did before. Okay, so for this patient here, if I generate a prescription, and again, going to first create the ePrescription by printing that. Sorry, I need to put some directions in there. Okay, so we've got our ePrescription. Now we need to click on the icon here which says send to fax or email prescribed medications that are in bold. So when I click that icon here, it's going to default to the pharmacy that I've selected, but this ellipsis will open the address book if you need to search for a different pharmacy. And then you've got your two options here, fax or email. So I've closed my email for the live webinar, otherwise we'd be interrupted every 5 seconds. But I'll show you an example of what happens in a practice when you've emailed the prescription. So as you can see on the screen here, when you email that prescription, it shows, you can see a little copy there of the prescription with the barcode, and then the subject line will say prescription from the location for the patient's name. Okay, so back into Medtech32. So if I look at a patient who I have emailed a prescription for already, these are some of the enhancements in the latest release. So for this patient here, I've emailed their prescription to the pharmacy earlier. What it does now is it creates a patient contact for the daily record to show, as highlighted on the screen here, that the prescription itself has been emailed to which pharmacy, and it's all captured within the daily record. This also happens for a prescription that's been faxed for a patient, so I can show that one as well. Here you can see it's been faxed. Once you've faxed the prescription, you can check the status of that fax in the Tools Message Transfer Messages Lodged section here and under the Fax tab. So this will display status and any explanation of failure if for some reason that fax hasn't been sent. This audit information is also captured in the medication itself. So if we look at that patient earlier where I had emailed their prescription, the audit trail here will show on the bottom right hand side when it was emailed and the ePrescription skid and further details about that email that was sent. So that's an enhancement from the previous release where that didn't auto capture that information, and practices were checking their email client to see what email was sent for the patient. So now I'll just make a few comments about controlled drug scripts. So NZePS controlled drug scripts must still meet the current regulations, which are that they require a physically signed prescription to be sent to the pharmacy within 2 days of that prescription date. So non-NZePS controlled drugs require the controlled drug triplicate form to be completed and sent to the pharmacy. So this means that signature exempt prescribing is not suitable for controlled drugs. Okay, we did have a few questions about that last time, especially regarding printing and having to change your print settings to print a controlled drug script versus doing signature exempt prescribing for the rest of your medications. And one suggestion that was quite popular is, instead of changing the print setup, if you need to do a controlled drug, you can actually just print the PDF prescription as you normally, instead of cancelling it, you can print it when you generate that prescription. Otherwise, you can just change your print settings and change them back again when you finish doing the controlled drug. Right, so that concludes the demo in the PMS, but we'll come back to it for the Q&A session. I'm just going to show you where the additional resources are found. So on the screen here, you can see from our Insight Customer Portal, if you click on the COVID-19 Resources button, it will bring up a menu that shows the NZePS resources for Medtech32 and Evolution. So if you click into that, then you can see all the different resources available, and those are both in user guides and in short webinars on how to prescribe and how to amend and that sort of thing. Okay, so that is the end of this demo. So I'll now hand over to Chrissy and Romit to kick off the Q&A session, and we'll go back into the PMS shortly. Thank you.
Thanks, Holly, for that. We've got a few questions here that have been raised as we've been going through the presentation. So I'm going to read out these questions and Romit will talk you through the answers to these, and if necessary, we'll show them in the PMS system again if required. So the first question here is around controlled drugs, and do these still need to be handwritten? Romit, do you just want to reiterate the process there?
Yes, sure thing. So for controlled drugs, these do have to be manually separated off from non-controlled drugs. So the way that this can be done is by ticking the non-controlled drugs or ticking the controlled drugs first and printing, creating an e-prescription for those, and obviously getting the printout. And then obviously pressing the print button for the non-controlled drugs, and for the non-controlled drugs then you have the additional option of emailing those off. So so you'd have two separate prescriptions for you to send off, one which you would have to sign, the other one you have the option to sign manually or to send via email.
Cool, thanks. What if you want to be able to add a medication before printing it? That came up during the demonstration that Holly did around the printing and parking process.
Yes, exactly. So what if they want to add medication? So I mean, you can you can just add medications as much as you want prior to printing it, and then you have the additional option of printing and parking it, as long as it hasn't been generated into an e-prescription yet. Then you can keep adding medications for a given e-prescription. In the event that you wanted an additional medication to be added to a given prescription which you had generated an e-prescription for already, you'd then have to go through the amend process, where you essentially cancel and repeat all the medications from that e-prescription, add the medication or modify any medications which are in there, and then generate a new e-prescription from there.
Okay, great. So the next question here is, what version of Outlook is supported, and does it have to be 32-bit?
So for the for anything to do with our on what's supported, please refer to our SRS on our website, our system requirements specification, and this is available on our website and inside customer portal.
Okay, so the next question is around, is there any additional cost for e-faxing? So for the answer to that one,
yes,
I can deal with that one. So as Holly would have mentioned earlier,
okay, yep.
there is a cost for e-faxing, and if you're interested in using that service, just get in touch with your Medtech account manager and they will talk you through it and what the costs are associated with it. The next question here is around in setup, how do you set the defaults to get reminders if scripts are not dispensed and the time period for the task reminder when using print and park?
Scripts not dispensed. Okay, so so for the reminders, it can be set up. It can be configured at the time of generating a medication, or you can set it as a default from setup connected health information services, ePrescribing, and go to the activate staff. So you can set the non-dispensing notification for which doctor would like to have be reminded in the event that any medication is not dispensed for a given period of time, and that given period of time can be defaulted for all doctors from the practice setup tab under the default non-dispensing period. So what this default non-dispensing period will do is that when you open the medication, if it's 3 days that has been defined under this tab, then when you open each medication under the dispensing tab, it will show 3 days by default, which can be altered at the time of generating any of the medications. And what was it? Was there a second default that was asked about?
Yeah, around the time period. Sorry, the time period for the task reminder when using print and park.
Oh, we'll need to get back to them on that. I think it's yes, I'll have to get back regarding that. I think it's hard coded. I don't think there is a change that can be made there.
Okay, that's fine. So the next question here is around the script printing. There's a couple of questions here around the prescriptions that are sent via email showing the copy only banner at the top that has been removed in the latest release. If you upgrade to the release that we put out around a week ago, that copy only banner has been removed from the top of the scripts now and is no longer there. So for those few people that asked that, that will be removed when you upgrade. Can e-prescriptions be emailed to patients is the next question. So for that one, when you have the email screen presented to you after selecting the recipient from the address book, if you would like to add the patient email address into it, you can add them in. You have the ability to add other email addresses into that email compose window. So you would just need to add the patient's email address in there so you can send a copy of it to the patient also for them and their records. What do you have to do to set up e-faxing? Does it just automatically go to the pharmacy fax machine from hitting the send fax? So as we mentioned earlier, yes, you just need to contact your Medtech account manager. They will talk you through the process, and once you've been set up, you will be provided with a username and password, which are added into the location setup within Medtech itself. And then when you basically click on the fax button and you've selected your pharmacy from your address book, on hitting send, it will send the fax directly to the fax machine at the pharmacy. Obviously that pharmacy address book entry will need to have a fax number for the pharmacy added there so it knows where it's sending it to, and then you can track them all through their fax tab of your message transfer. Next question here. Our Medtech version isn't showing a pharmacy the script was emailed to in the daily record. You do not have the most updated version of Medtech. No, that's correct. It's only released last week, the enhancement that we added to the software to be able to do that and write back to the daily record which pharmacy you have emailed or faxed to, as well as the update into the audit tab of the medication record. So you will need to upgrade to that latest release, and then you will have that capability for you as well. I found that once an e-prescription is done, I could not untick the box long term if I needed to. Romit, do you want to take that one?
And that once e-prescription is done. Yeah, so with once e-prescriptions have been generated, then there's essentially two copies, one from the PMS from Medtech32, and another one from the hub where it's been stored awaiting to be downloaded by the pharmacy. So in order to ensure that there's no discrepancies between those two copies, we need to go through a process where we essentially cancel the e-prescription that's on the hub, and in turn cancel the one from Medtech32. And the reason here is, so now in order for you to then make a change once you have generated an e-prescription, is you would then have to go through that cancel process. And there's two ways to do it. One, you can use the amend functionality, or two, you can go into that specific medication and cancel the medication and make the change. So yeah, we just have to go through a process of essentially canceling, repeating, and then making any change, so such as change it to long-term and any other medication change if necessary.
Okay, cool. The next question here is, we're having issues in our practice with scripts that are supposedly sent to the broker and have an active status, but the pharmacy says that they don't have it. Where might there be the problem?
Okay, pharmacy says they don't have it. I see. So there's several possible issues here. So in the event that it hasn't gone to the broker yet, then there may be an issue at the Medtech32 side where the service hasn't sent it to the broker. So it would actually have to get investigated by one of our support teams. So the best thing to do there is just to call our customer care number and connect with one of our support team members who can then go through the troubleshooting steps to determine what the problem is. But yeah, essentially, if it's a time thing, then we'll need to work out what's going on with the delay, why there's a delay. But if it's actually not ever getting to the broker, then there's probably a more bigger underlying issue that needs to be investigated on.
Okay, great. The next one is somebody saying that they could not find the amend button. Do you just want to show quickly where the amend button is in the application?
While Holly does that, you do need to ensure that when you are going to amend, you have to actually select the e-prescription that you're wanting to amend. One above it. Yeah. Yeah, there you go. So you could see there that until she had selected the e-prescription, it wasn't, the amend button wouldn't come up. So that's the key thing with the amend button. Great.
Okay, so the next question here is, we are on e-prescriptions and are sending via email. Some of the pharmacies are saying that we should send by EDI. Will the fax function send by EDI? So no, it won't. There are three separate capabilities. There is faxing, emailing, and then sending via EDI. The EDI capability, we're still building into the software at the moment. There will be a release towards the end of May to allow you to send a e-prescription script to a pharmacy using their EDI. So that capability is coming shortly and will be available, and all practices will be advised when you can start using that capability within the software. Not all pharmacies are using that EDI capability at the moment, only some of them. So it will start getting more and more popular, and we'll have the capability in the software to support that shortly. The next one is some pharmacies do not accept e-prescriptions presented by patients. That's an interesting one, Romit. Any comment on that one?
Do not accept e-prescriptions presented by patients. Have to talk to the pharmacy. I mean, they're probably obviously concerned about the coronavirus.
There's no reason
maybe
why a
there's
pharmacy
a option.
shouldn't accept one.
Yeah, no, they shouldn't. I mean, they could. Yeah, that would probably talk to your pharmacy about that, or the pharmacies who are saying no, and then just work with them to determine the best method of getting the prescription to them that they accept.
Great. Next question here is another question around we are set up and e-prescribing via email. We don't have the features shown in your presentation on emailing, and the email header does not have the patient name. As I mentioned earlier, that is available based on the new release that we put out for practices last week. So as soon as you upgrade your practice to that latest version, you will have that capability available for you to be able to use and have available within the software. Sorry, I'm just trying to see which other ones we've got here. How do we add signature exempt to all of our scripts? Okay, so Holly, maybe you can navigate the software for this. There is a capability within the application under the staff setup for a provider where you can add what we call a RX message. So if you go into the setup of a staff member and click on the provider messages tab, here you will have the ability to enter an RX message. So if you type in here the wording that you would like to have printed on the scripts, signature exempt or any other type of wording, and enter an RX start date and RX expiry date as well. So that's the start and end date for which those messages will appear on the scripts. You can customize that content there. So you just need to go through your staff setup and add in the messages that you would like to have printed on the scripts, and they will print on every script until that RX expiry message date is hit, or you remove the RX message itself from within the setup of the application. Is the electronic faxing ready to start? Yep, as long as you've upgraded to the latest version that we have available for download at the moment that we released last week, you will be able to use that electronic faxing capability. Just contact your Medtech account manager so that they can talk you through that process. Will secure script be offered by Medtech to transmit options to the pharmacy? So yes, we will have that capability available shortly. As I mentioned a bit earlier, that's the capability to send the prescription to the pharmacy via EDI. So we're building that at the moment into the application, and we're expecting that to be available by the end of the month for practices. Will the pharmacy still require paper copies signed after lockdown? At the moment, the exemption in place means that you do not have to provide the paper copy unless it's for a controlled drug. And there are obviously the information that Holly provided earlier around that. And when you need to provide those is important to understand. But for a standard script, you won't need to provide a paper copy signed after lockdown. Romit, can you not print in the print and park function?
You can print in the print and park function. The only difference between the print and park and the standard printing is that the parked print has a draft over it and no barcode. Yeah, so and there's the means to reprint both e-prescriptions and part e-prescriptions by just going into the actual e-prescription or part e-prescription and clicking the print button from the view e-prescription window.
Romit, I think maybe this question, we had this quite a bit last time as well, is practices don't want to print when they're pressing print and park. They're just wanting that prescription to be parked in the PMS but not printed. So for those practices, if you're set up the way I am, and if you're wanting to prescribe and do print and park, I'll just re-prescribe Panadol. It's my favourite for the day. And if you just set up for signature exempt prescribing, where you just have the nurse's computer set to print to a PDF, then all you need to do is cancel in the pop-up that appears. So I'll show you that now. If we prescribe this medication here, and I'm going to select the print and park, what that's doing is bringing up this window here. All I need to do is go cancel, and that doesn't print the prescription, but that prescription is still there for the person who needs to verify it. Okay.
Well, thanks for that one, Holly. So the other question here, can you tell us how to download the local pharmacy address details for the address book? So that is one of the resources we have available on the Insight Customer Portal on our COVID-19 resources page that Holly showed a bit earlier in the presentation. If you go to that page, you'll be able to find the pharmacy address book load, where you can download the pharmacy addresses and install them for your local region. So Holly's just showing that now on the screen. So you can see the pharmacy address book load utility there. And that gives you the option to choose to load the pharmacies within your region or regions around your practice that you'll be able to have available within your address book with the content that has been provided to us to make available. Is there a cost to the updated version? There's no cost to upgrade your Medtech32 application. You just need to download the latest release from our Insight Customer Portal and run it on your practice, or have your technician run it for you, if that's what you usually do for a Medtech32 upgrade. The cost that is involved, obviously, is if you want to use that eFax capability, for which you should contact your Medtech account manager to get the details for that. Is the signature exempt continuing after lockdown? I'm not sure on that. We're directed by the Ministry of Health in terms of the their guidelines that they're providing. The capability will always be available in the software. It's not something that we're turning on and off. Obviously, you just need to listen for the Ministry of Health directive of whether you can continue to do signature exempt prescribing or not after lockdown, and take your guidance from them over that. What will happen to a prescription sent by EDI if the pharmacy is not making use of this function? If your when that capability does become available and you attempt to send to a pharmacy via EDI and they're not using that capability, that message will not be acknowledged, and you will obviously be provided with information from that acknowledgement that the pharmacy hasn't received it. Obviously, it would be best to check with the pharmacy first before you start sending them via EDI to make sure that they do have the capability to receive them in that manner before you start doing it. And do you need to have signature exemption on the eScript? I believe you need to have some content there to say that the signature it's signature exempt. However, it is very well known, obviously, at the moment that pharmacies are able to receive scripts via email, via fax, as long as they have been prescribed via the NZePS capability and have a barcode on them to be eligible to be signature exempt. So as long as they're using NZePS to generate those e-prescriptions and send them through to the pharmacy with the barcodes, there should be no issue there in terms of the pharmacy dispensing them. Okay, I think, Holly, that's probably all of the questions that we have. There's some of the questions that have been asked we haven't covered. They are a little bit more complex and require us for us to follow up with you separately later on. And so we will do that after the webinar. We'll have somebody from our support team contact you to cover off any remaining questions.
Great, thank you guys. Thank you for watching the webinar today. If you do have any other questions, feel free to contact us through our support page. Thanks everyone.